Are there any potential side effects associated with high blood pressure medications?
Hello everyone. Today, we'll be diving deep into the world of high blood pressure medications. We often hear about the benefits of these drugs, but it's equally important to understand their potential side effects. Knowing these side effects can help you make informed decisions about your health and ensure you're prepared for any potential complications.
Why are high blood pressure medications prescribed?
High blood pressure, or hypertension, is a condition where the force of blood against the walls of the arteries is consistently too high. This can lead to serious health problems like heart attacks, strokes, and kidney disease. Medications are often prescribed to help control blood pressure levels and reduce the risk of these complications. While they're beneficial, it's essential to be aware that they can have side effects.
What are common side effects?
The side effects of high blood pressure medications vary based on the type of drug, but some common side effects include dizziness or lightheadedness. This can occur especially when standing up suddenly. Cough. Some drugs can produce a persistent dry cough. Frequent urination. This is common with diuretics or water pills. Erection problems. Some men may experience difficulty with erections. Feeling tired or fatigued. This can be a common complaint with these medications. Skin rash or itchiness. Some people might develop allergic reactions. Elevated potassium levels. This can be dangerous if it's severe.
Can everyone experience these side effects?
No, not everyone will experience these side effects. It's also worth noting that side effects can be mild or severe. Many people might have no side effects at all. The best approach is to discuss potential side effects with your doctor, monitor your body's reaction to the medication, and report any unusual symptoms.
What should you do if you experience side effects?
If you believe you're experiencing side effects from your medication, 1. Don't stop taking the medication without consulting your doctor. Stopping suddenly can be dangerous. 2. Keep a record of your symptoms. This can help your doctor understand and adjust your treatment. 3. Discuss alternatives. There might be other medications or dosages that can control your blood pressure without causing side effects. Thank you for joining us in exploring the potential side effects of high blood pressure medications. It's always important to stay informed and proactive about your health. If you ever have concerns or questions about your medications, always reach out to your healthcare professional. Stay safe and stay informed.